Dr. Surani is joining us live this morning to answer questions that you have regarding the pandemic. Before we get to those questions, Dr. Surani, I want to address the fact that so many events have been canceled or postponed. The Grammys are one of them. Flights, travel, all of those industries have been affected. We talked about hospitals about 30 minutes ago, and it's not that there's a shortage of beds, there's a shortage of staff. Many of us turn to our elected officials for help, but we're throwing up our hands in the air right now because we're not getting the response that so many people want, because we look to them for guidance. We're looking to you this morning. What can somebody do to kind of make it through this latest surge, knowing that Omicron isn't that serious when it comes to illness, but yet it still is a chance for someone who is unvaccinated to get really sick?
Good morning, John Thomas. The number one thing is get vaccinated and boosted. I think this is a key thing. That is a very, very important. Second thing is, if you are sick or if you are having any symptom, get tested and don't go up and show up to the work. One of the biggest challenge what we are facing is that we are not adequately testing. So the main thing is that people go to work, and we know that this virus has very mild symptoms, and they go to the work and they probably are positive, and they are infected a lot of people around them, and then they go to their family and their family goes somewhere else, and it creates a ripple effect. The key thing is that if you can find people at a very early stage and isolate, that slows down the process, and that prevents the collapse of the system and the workforce more efficiently. But one of the thing is, I think, as I mentioned yesterday, my thanks goes to the frontline worker in every area, because you got to realize your colleagues may be out for 5 to 7 days, and you have to carry the burden. And then you may be out yourself for a few days, and someone else has to carry, and together we can all pull through that. So this is a time where people have to pull some little extra weight, and till your reinforcement comes in. So this is a fight where we can, number one, prevent by getting vaccinated and boosted, and number two, we have to all work together. And we all have to watch each other's back, and that's the only way we can get through. And if we can ride through this, it's a short term. Hopefully within the next few weeks, the surge will start coming down, and then we hopefully can be back to normal, because virus is compromising. It doesn't want to kill the host. It means it wants to live with us happily, and we can just see the variant, and we can probably get a booster like a flu shot every year and go from there.
Okay, well, Dr. Surani, at least there is a booster out there now for 12 and 15-year-olds that just got approved last night, and people have already started doing that here in the county. Dr. Surani, let's get to our viewer questions rapid fire really quickly. If a person who receives the COVID vaccine or booster experiences a reaction, should we avoid contact with them?
No, not at all, because whenever you give the vaccine, it doesn't have any virus, so there's no risk of any infection there.
Okay, the next viewer says, I got my booster on the 27th. I was going to get tested, but the line was hours long. Right across the street, I could get a booster in 5 minutes. I kept feeling more ill, so 2 days later, I got tested and tested positive for COVID. Not a week later, I still feel sick. Is it bad that I got vaccinated while I was sick with COVID?
So there's two things. I think number one, if you are sick with a COVID infection, you don't get vaccination. You get the infection to be over and then get vaccinated. In your case, it seemed like you got a booster and then you had some booster side effect, but it continues, and you got a breakthrough infection between the booster dose and your symptoms. So that is what we see is a lot of the time it takes about 2 weeks for the booster to get effective. So no, you did not did anything wrong by getting vaccinated. But if you're infected, then wait for the infection to get settled and then get boosted.
And finally, this viewer says, good morning. Should I be wearing gloves?
The gloves is good as long as you wear it for one task and dispose it. For example, in hospital, you may have seen doctors or nurses going in a room. They take care of one task and they remove the gloves, wash their hand with the soap and water. So soap and water is the best thing. But for a public to wear gloves, actually, it increases the risk of infection, because when you wear the gloves, you touch one surface and then you go to the next surface. You touch that like somebody in a grocery store. So if they get an infection, they will spread the infection every places where they touch, or if they touch their face, mouth, it's all over. So it can work in a very specific small task, like somebody is serving you and that's the only utensil they're holding. That's good. Otherwise, you have to keep on changing gloves for every task you do.
Dr. Surani, Thank you so very much for spending your time with us this morning. And thank you to all of our viewers at home that submitted these questions. We do get to them the best that we can. We understand sometimes you get frustrated because we don't answer right away, but we do get to those questions. So with that in mind, if you do have a question for Dr. Surani, please send us a text at 361-855-6397 and be safe out there. Get vaccinated.